Good morning, sir.
Got
Good
it?
morning, sir.
Good morning, sir.
Happy New Year, sir. Happy New Year.
Happy New Year to all of you again.
Happy New Year, sir.
Happy New
So,
Year, sir.
well, it's okay. We will be beginning today's class. I think we have done the general anatomy and the terminologies of general anatomy, right?
Yes, sir.
Yeah,
Yes,
in
sir.
Yes,
the
sir.
previous
Yes,
two
sir.
classes, before a lot of you got suspended because of your good deeds with our teachers and our college. I think we have completed two classes, right? The gap between these
Yes.
two, the previous two lectures and this one increased because of not me, but you. Make sure that you don't do such things where we have to, uh, deal with you in a way we don't like. Okay? Am I making myself clear? Hello?
सर आवाज बहुत कम आ रहा है सर.
अभी ठीक आ रही है?
यस सर अभी ठीक है.
या मैंने ये
Yes, sir.
बोला ना कि अपने एक्शंस को वैसा ही रखना जिसमें आ, हम लोग वो करने के लिए मजबूर ना हो जाए जो हम नहीं करना चाहते हो. ठीक है? Be the student you want and you should. Okay. Today we will be beginning with this next chapter of general anatomy. We will be talking about bones and bone tissues. Anybody can help me with what is bones? What is bones?
हड्डियाँ.
Haddiyan, yeah. That's the literal meaning of the word. How do you define it?
Sir, bone is a long structure. It's like a hollow, and it have some minerals, calcium, etc. etc.
Okay.
Sir, it is a type of connective tissue.
Fingers are the connective
Yeah, yeah, yeah.
tissue.
Yes.
Yeah. Very good.
It is the main substance that forms the skeleton of the body.
All right. Nice. So there are three different answers we achieved after this question. See, you can try. You can try any answer you want. Be it wrong, be it right. It doesn't matter. You have to try. In my class, you will be trying a lot. So yeah, first thing, it is a connective tissue. Long, hard substance. Long, yes, true for some time, and is different for some other cases. It's hard, very much hard, and then forms the framework of the body. Three people answered, three different points are covered, and together you combine these three different segments answered by three good people of our class, and you will get a definition of bone. Okay, so let's just have a look at the first slide of today's class. The definition, yes, it's quite long. Bone is a rigid body tissue consisting of cells embedded in an abundant hard intracellular material. Getting it? समझ में आया कुछ यहाँ पे? First sentence.
No, sir.
We
Sir,
need to
repeat it.
understand here the bone, a rigid body tissue. The body tissue that has rigidity in itself, consisting of cells. What happened? Yeah. So consisting of cells. How do you define cells?
Sir, the basic structural and functioning unit of life.
Unit of the life. Yeah, exactly. The smallest unit that is living. Okay. So because of this, cells are present in our body on the bones. Bones, even though it is a hard and rigid structure, it's not that it is not living, it is non-living. It is living, it responds to so many things, it responds to so many actions. It has its own mineral turnover. So the bones are living cells, they are tissues that is embedded in an abundant hard intracellular material. Sorry, intercellular. Like intercellular means the gap between these two cells is covered by this abundant hard intercellular material. The calcium salts, the phosphates, the collagen, other materials, everything will occupy the intercellular area and makes it a hard connective tissue. Clear with this? It's one of the most remarkable tissue of the human body. Well, every single tissue of the human body is a remarkable one. Eyes, the brain tissue itself is a miracle, I think. When we talk about blood cells, again it is a miracle, like it is a remarkable tissue. We talk about skin, nonetheless, it's very remarkable. But similarly, bone is also a very remarkable tissue because even though it is hard, it is living. It is it is strong, and it helps you in like locomotion, protection, support. So many other functions are carried away by bones. The bone serves a wide variety of diverse function as I was discussing right now. Now, in the next one, let's just have a small, like a further look. We saw that bones are formed by the minerals. Calcium phosphates are there. Then the minerals are also stored in there. Apart from that, we had cells that are present in our bones. Can you name the cells of the bone? Anybody?
So, four types of cells:
Okay, four types. चलो बताओ.
osteoblasts,
हम्म,
osteocytes,
हम्म,
osteoclasts,
हाँ.
bone lining cell.
Sorry. वापस से बताना बेटा एक बार.
Osteoblast, osteocytes,
Osteo.
osteoclasts,
हाँ.
plus bone lining cell.
Okay. Well, bone lining cells. That's okay. Well, when we talk about these cells that are present in the bones, okay, the cells that are present in bones, we have three important segments here. First is osteoblast, very rightly said. The progenitor cells, the cells that are not mature and is about to get mature in its due course of time, it will become a mature bone cells. So immature cells, in the process of getting a mature bone cell, is the osteoblast, the blast cells. Blast, any cell that has a blast in it, it will be the premature cells of that particular category. Be it anything. जैसे बोन्स की स्टडी को ना हम ऑस्टियोलॉजी बोलते हैं. तो उससे रिलेटेड जो cells हैं, we are calling them osteoblast. When we talk about osteocytes, osteocytes are the mature bone cells. Okay. And osteoclast. What are osteoclast? Yeah. After a point of time, they work in removing the bone tissue. They have their degenerative properties. We will be discussing about it in later segments. Now, these are the cells present. Minerals, we saw a number of mineral are present in bone. But apart from that, there are nervous tissue and nerve endings present within it. Blood tissue and blood vessels are also present in it. You all must have seen or eaten bones, right? All of you are non-vegetarian,
Yes, sir.
Yes, sir.
huh?
Sir.
Sir.
Yes, sir.
Yes,
Yes,
sir.
Yeah.
yes, sir.
So when you are eating
Yes, sir.
something, like eating say a chicken, and you break the bone of that particular chicken, inside brown material you can see, right? That
Yes,
is
sir.
that is the bone marrow area. Now, their main function is production of RBCs. In human being, bones are studded with bone marrow that helps in production of red blood cells, the blood cells. Now, because the blood cells are produced in the uh, bone marrow area, it's really important that they should be in the circulation. For getting them in the circulation, it has to be supplied by the blood vessels that can pick up those RBCs or whatever blood cells that are formed. Okay. Cartilage in articular cartilages. Now, what is a cartilage? Cartilage क्या होता है? नहीं सुना है? Okay. How many of you like chicken? Chicken कितने लोग खाते हो?
मैं खाती हूँ सर.
सब खाते हो?
मैं भी.
And then you must all like the leg piece of the chicken.
Yes, sir.
Right?
Yes,
Yes,
sir.
sir.
Absolutely. Now, once you have eaten the flesh around the leg piece, एक ना white color का substance आता है on the bones. Right? It's difficult to chew. काटने में थोड़ा सा मुश्किल होता है.
Yes, sir.
Remember? Yeah.
Yes, sir.
So ये कटता भी नहीं है, easily छोड़ते भी नहीं हो तुम लोग. Without getting it done, it's like next जब वो chicken का. So whatever it happens, that white substance that is very resilient, tasteless, उसमें कुछ blood vessel नहीं होता है, not soft, right? That thing is cartilage.
Sir, cartilage is also connective tissue, na sir?
Yeah, cartilage is also a connective tissue. It is mostly present in the articular region of bone. आप लोगों के कान है, ears, ठीक है? You try to shut it.
सर पिन्ना में भी अवेलेबल है सर.
Exactly.
Yes, sir.
Even your trachea is also studded with the cartilages. So these are the other cells that are present in the bone. Now, functions of bones. Okay. Functions of bones are important, like for examination purpose of examination point of view also. And this is an important topic. What are the different functions of bones? The several important functions a bone perform is support, like the entire bone system, the skeletal system perform is support. Number 2, it helps in protection. Number 3 is movement. Next one is mineral storage and blood cell formation. These are the 5 basic and most important functions bone perform. Okay, we can talk in little detail for each and every one. When we say support, what do we understand? Okay, the bone provide a hard framework that supports the body. Okay, what do we mean by this? When we say that the bone provide a hard framework that supports the body. आप लोगों ने buildings को construct होते हुए देखा होगा, right?
Yes, sir.
You all must have seen.
Yes, sir.
Yes, sir.
Or you can go outside wherever you are staying and कुछ unfinished घर दिखेंगे, so you will see the top of their the houses there will be iron rods coming out of the pillars. देखा
Yes,
होगा
sir.
Yes, sir.
iron rods
Yes, sir.
छत के ऊपर कहीं कहीं से
Yes,
निकले
sir.
होंगे, sideways निकले होंगे. These iron rods, what their function is, they start like हम सबसे पहले जब भी घर बनाने की बात आती है और suppose any building we are going to construct or whatever we are doing, what we do is we try to form the basic, the beginning framework, how this building will look like, and accordingly we start putting those iron rods and stabilizing it with the help of cement, sand, and pebbles, whatever we have. So the thing is, those iron rods are forming the basic framework of the building. In the same way, the body, the framework of the body is formed by these bones. Okay, the basic framework of the body is created by the bones and they help in supporting it. The bones provide support for internal organs. Internal organs, like bones, help in the support. For example, like from behind and from above, in the front, the abdominal organs are in its position because of the support created by a small positive pressure formed by the lumbar and the vertebra behind from behind and the muscle tone from the front. So these two together helps in keeping the abdominal organ in its support, in its position. When we talk about next one, protection. Protection is the most important function that has been observed or seen. Okay. So पहला point है protection. The fused bones provide a brain case that protects the vital tissue of brain. So my question here is like the skull, is it protecting the brain? How it is protecting the brain? The skull around the brain. Anybody?
By covering the brain.
By covering the brain. What happens by covering the brain?
So it acts as a helmet to the brain.
It acts like a helmet to the brain, right? Everybody listen. सबने सुना
Yes,
ये?
sir.
Yes, sir.
Okay.
Yes, sir.
Yes, sir.
It
Yes,
acts
sir.
like a helmet to the brain. Okay. So if it acts like a helmet to the brain, then why we are wearing helmets?
To protect
Cover
their
the
skull.
skull.
So you want a helmet for a helmet.
Yeah, sir, for better protection.
For better protection.
Better protection, sir.
So, do you think that skull that is formed around the brain is only for the protection from the trauma? जो इंजरी होती है बाहर से चोट लगने से, brain case protects the brain from only that particular thing. What are the other injuries that can happen अगर ब्रेन केस नहीं होता तो? So we need to understand what are the different injuries that a brain can suffer अगर हमारा ब्रेन केस नहीं होता तो. Okay, yes, trauma is one condition, but every single time if somebody is hit by a stone or it hurts, डेलिकेट है, थोड़ा बहुत ट्रॉमा वो बचा लेगा, हल्का फुल्का चोट लगा, बट अ सीवियर ट्रॉमा इन एवरी सिंगल केस a head injury will lead to some kind or other problems only. So yes, for mild injuries, this brain case definitely serve as a helmet, as very rightly said by a student of ours. But then the main protection it requires is not from the trauma. You think about it, life में एक या दो एक्सीडेंट होते हैं. ओके, एवरीबडी, एक बड़ा सा
Yes, sir.
एक्सीडेंट हुआ है, इसमें somebody is gone, he is gone. So for one incident, एक पूरा का पूरा केस फॉर्म करना, that's not legitimate, right? That's a solution to a problem which is not a problem actually. The brain requires to be protected at almost all the time. ठीक है, आप लोग ये सोचो ना, the brain, like every single other organ, they can have their different electrolyte levels, and उसमें fluctuation में भी it can work, but brain cannot work like that. It requires a stable environment. ठीक है, that's number one. Number two, the brain is continuously bathed in their cerebrospinal fluid. अब imagine करो, this entire brain case, and it's in continuity with the vertebral column. It forms a separate environment for the brain to be inside. Getting me? समझ में आ रहा है?
Yes, sir.
Understand
Yes,
this.
sir.
Yes, sir.
See, आप लोग जैसे मान लो एक रूम में गए, you are inside a school, आप लोग स्कूल में भी जाते होंगे या फिर जहां भी, there is one segment जहां पे एयर कंडीशन ऑन है, ठीक है, एसी अगर ऑन है तो दैट पर्टिकुलर रूम, उसका एनवायरनमेंट एंड उस रूम के बाहर का एनवायरनमेंट इज डिफरेंट. So what you do, because in that particular room air conditioning is switched on, हम उसका दरवाजा बंद रखते हैं, ठीक है, so that it doesn't get, like the outer environment doesn't affect the inside the problem. In the same way, inside this body there is a internal environment of the body. Within this brain requires a different form. Any kind of small infection that can go inside, कोई भी medicine अगर इसमें चली जाती है, it can cause a lot of problems. So this special arrangement that prevents this external things to enter the brain's environment, ये एक एक अलग सा कंपार्टमेंट बना दिया गया है. It keeps on protecting you for your entire life, not just trauma. Okay, always remember, when we are talking about protection, it's not only the trauma that can happen to your brain or your head that can result in something. It's the day-to-day changes that can happen because suddenly तुमने decide किया that I will have certain extra amount of salt, या आज हम लोग मिठाई नहीं खाएंगे, या फिर आज हम लोगों ने ज्यादा मिठाई खा ली. एक छोटी छोटी चीजों से भी ब्लड के इलेक्ट्रोलाइट्स, ग्लूकोज, सोडियम, पोटेशियम levels can vary, but that variation should be not like, it shouldn't reach the brain. That one thing is there. Next one is spinal cord. When we talk about spinal cord is again protected by the vertebral column. Okay, this vertebral column is presented with a canal, the vertebral canal, through which the spinal cord passes. The rib cage is Rib cage protects the vital organs like the lungs and the heart. Okay. Now, how they are protecting lungs and heart? Rib cage. Anybody? Nobody? सब हो कि गए. Let's see.
Sir,
Yeah.
can you repeat the question again?
How the rib cage protects lungs and the heart.
Okay. I don't know, sir.
Sir,
Whenever,
uh,
Yeah,
whenever,
anybody.
sir,
Sir,
whenever we
it works.
fall,
Yeah.
sir, whenever we fall or something else, then it also protects from trauma, sir.
Yeah. Again, the
Sir?
trauma. Yeah. Yes,
Sir,
bolo.
it works as a framework around it.
Yes, definitely. It works as a framework around it. So that's
But
how
it's the
it
function of
protects.
bone, sir. It's the function of bone, sir. It always works as a
Yeah.
framework.
Absolutely.
So it acts as a flexible framework.
Exactly. That is very important. Now, because I started talking about how the protection phenomena of brain case is different, not just for trauma, but here it is protecting us from trauma by being flexible. Okay, see, every time आप सब लोग जोर से सांस लेते हो, ठीक है? I don't know whether you will listen to me or not. एक बार सबके सब बहुत जोर से सांस लो, ढेर सारा. Put in almost every air present in your room. जोर से सांस लो सब. Yeah. See, what happened now?
So
Because you
diaphragm
inhaled a lot of air inside, your lungs expanded a lot. Okay? Now, if your thoracic cage or rib cage that we have lately, very nice. Not diaphragm, lungs. Okay. A diaphragm expands when you exhale. It goes down, na? Anyways. So, what happens next? उससे क्या होगा? First, it will start putting impressions on the lungs, the boundaries of lungs, and later it will start destroying it. Okay, so this is how it prevents the trauma. Nobody is attacking you, like somebody is trying to attack you with, say, something pointed or something. What will it do? It will not protect you from that. अगर किसी ने decide कर लिया कि भाई somebody will apply, put in a knife inside somebody's chest, what it can do? They will try it. So वो तो push कर देगा. The protection we are talking about is something different entirely. Okay. Next, the movement. The skeletal muscle that is present around the bone and the joints formed by them. The movement of this muscle help in moving the joints. And because of this movement of joint, we can move from one place to another. We can locomote. We can move here and there. So that's what movement we are talking about. Next is the mineral storage. Everybody knows minerals are among like hard. Which mineral is liquid?
So, mercury.
Yes, very good. So these minerals basically are hard substance at room temperature, be it iron, copper, zinc, calcium. So all these are present in their hard state. Bone serves as a mineral reservoir. Whatever is not required is either excreted or is taken up by the bones. It's there till the time body needs it. Once body needs it, it releases the mineral. Okay. And next one is blood cell formation. ओए तुम लोगों को मैंने कुछ होमवर्क दिया था क्या? I just
Yes,
remembered.
sir. Yes, sir.
So drawing data.
You gave two
दिया आप
diagrams,
लोगों
sir.
ने?
Yes,
Yes,
sir.
sir.
बनाया
Yes.
आप लोगों
Yes,
Yes,
ने?
sir. Yes, sir.
ने?
Yes, sir.
सबमिट किया था?
सर आपने
लेकिन
तो
सर
ऐसे नहीं क्रिएट किया
आपने
था।
तो खुद लिंक
assignment create
लिंक
किया
भेज
था
दिया।
ना।
ओके, चलो कोई बात नहीं, मेरी गलती थी। ठीक है। So next, the blood cell formation. Blood cell formation is also known as hematopoiesis, the first word. ठीक है? Hematopoiesis is also known as the blood cell formation. This blood cell formation is a process, it's a very important process. Constantly, we require blood cells in our body for the basic function of gaseous exchange that happens. You know, gaseous exchange is an important process because our cells require oxygen to perform metabolism, and we release carbon dioxide, which we don't need in our body. Like yes, without CO2 we cannot have this oxygen. इसका भी एक अलग physiology है, and Subro sir will explain it to you in his classes. But right now, let's just say that for gaseous exchange, we require red blood cells. The red pigment that is present in the RBCs. It helps in binding oxygen and CO2 and helping in gaseous exchange. Uh, uh, Related to this only, I'll ask, what is the normal range of hemoglobin present in the body?
Sir, 13 to 14.
Okay, and for females?
12 to 15.
Nice. 15 बहुत ज़्यादा हो गया, but ठीक है, चलो कोई बात नहीं. In normal adults, irrespective of this, let's have a range of 12 to 14. ठीक है, 12 से 14 के बीच में it will be present. Now, when in the life hemoglobin level is highest, and in whom? किसमें होता है ये? Anybody? Think. मतलब hemoglobin level is almost 17, 18 तक पहुंच जाता है, होता ही है. When? Nobody?
सर हीमोग्लोबिन लेवल तो सर बुढ़ापे में कम हो जाता है सर.
Sir, it's
कम
childhood. Sir, childhood.
Childhood में भी कम बेटा. At the time of birth. Okay. At the time of birth, the hemoglobin level is almost 17 to 18. Why? क्यों? कुछ भी guesses? Any guess? Anything you want to say?
क्योंकि सर बॉडी में तो हमेशा ऑक्सी हीमोग्लोबिन कंटिन्यूअस बनता रहता है. सो आई थिंक यही कोई रीजन हो सकता है.
Okay. Any other wild guesses like this?
सर बात करने के वजह से
Sorry?
बात करने
Okay. No, ऐसा नहीं है. See, what happens ना? जब in the intrauterine life, when the babies are within the uterus of mother, at that particular time, the circulation for the food and everything, जो baby होता है ना, it is mostly dependent on the umbilical cord and placenta. indirectly it is dependent on the mother. Okay, no, because it is dependent on the mother and the route that it follows is completely different. So it needs to have a different arrangement in the body for the circulation and everything. Okay. Now, when we are talking about the special arrangement, the RBC production is also done differently. Okay. Instead of bones producing RBCs, the liver and the kidneys are producing RBCs. The process of hematopoiesis has been taken care by the liver and kidneys and not the bone marrow. Okay, now that is known as extramedullary sites of RBC production. Okay. By the time the baby starts maturing, the process of hematopoiesis is being transferred from these sites, such as liver and kidneys, to the bone marrows. Okay, everybody with me here?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Okay.
Yes, sir.
Now, because the formation of RBCs is being shifted from these extramedullary sites to the bone marrows, to the bones, it doesn't mean that the production of RBCs from liver and kidney stops immediately. Okay, it takes some time. Okay, it will take some time even after birth to get completely shifted to the bones. So, because of these two extra sites of RBC production, the hemoglobin level is high. Okay, so always remember bones are not the first hematopoiesis sites. It starts only after birth. Clear? So this is why at the time of birth, the hemoglobin level is way too high than in the general life. We talked about classification of bone. You all must be knowing something about classification. How do we classify bones? Anybody?
So, according to shape,
According to
region,
shape,
According to the shape. Yeah. What are the classification according to the shape?
So long bones,
long bones, short
Long bones.
bones,
Long bone, short bone,
short
Flat
long
and
bones,
irregular.
flat
flat
bones,
bone,
Very
irregular
good.
bone,
numeric
sesamoid
Absolutely.
bone.
bone.
sesamoid bones.
This is something that we all carry from our school days. The classification of bone, well, it is varying in shape and sizes definitely. The unique shape of each bone, it has its own particular requirement. Why a bone is like that is because it is serving one certain purpose. Okay, so bones are classified very rightly said by all of my good students that they are classified on the basis of their shape into long bone, flat bone, irregular bone, and short bone. Now, it has two components that is also important, the compact and the spongy osseous tissue. Spongy bone and compact bone. In most of the cases of bones, there will be a internal spongy bony tissue present. Okay, you know what is a sponge? Sponge पता है ना?
Yes, sir.
Oh come on, yeah. Why are you taking
Yes,
such
sir.
time? So Inside is always a spongy bone, and outside is covered by a layer of compact bone. In the long bones, this sorry, in the uh, long bones or the stronger bone, the layer of compact bone is thick and very strong. In short bones, the layer of compact bone is not that strong, and in flat bones we talk about. Now, there are two outer tables of compact bone, and inside, in between these two outer tables of compact bone, we have the spongy bone present in between. So these are special arrangements. Let's have a look at the classification. You all can see this.
Yes,
Yes, sir.
Yes, sir.
Yes, sir.
When we talk about long bones, we have humerus, ulna, radius, femur, and tibia. So all these forms in the category of long bone. When we are talking about the short bones, we have the carpal bones, the tarsal bones. These are short bone. Irregular bones are those bones that doesn't have a particular shape, and they are always the hip bone, the vertebral bones. These are the irregular bone. The flat bone is a bone that is that has like two parallel linings, and they are mostly curved. For example, the skull bones, like the skull, the skull cap, the ribs, the sternum, these are falling under the category of flat bones. Yeah, these are the long bones. They have a elongated shaft, okay, and it has two distinct ends. When we say distinct ends, it means we can identify or differentiate whether the upper and the lower ends are which is, or the medial and lateral ends. So we can identify them as the two distinct ends of one bone, and they are known as long bone. The various examples we have mentioned, these are present here: the humerus, the radius, ulna, the femur. Femur is the strongest and longest bone of the body. Which is the smallest bone of the body?
stepis.
Very good. Then we have
Avoid
the
bones.
na, na, huh? Then we have the short bones. As we have already discussed about the short bones, they are cube-like, and they have a very thin layer of compact bone that is present above. Now, let's go to the flat bones. Flat bones are thin, flattened, and usually curved. We can see as the sternum and the other rib cages, this even the skull bones. If we take it up individually, we will understand that these also falls in flat bone region. Classification is irregular bone. It doesn't fit into any previous category. Like it cannot be a long bone, it cannot be a short bone, and it cannot be a flat bone. Basically, we cannot decide what is the shape of these bones, and thus we are calling it a irregular bone. And it has a spongy bone with a thin layer of compact bone that we have already discussed. The various examples we have are hip bone and vertebral column. Bone structure, I really think when we will start with our physical classes, I want to cover it there, because then I'll be able to show you it on a bone in the lab, anatomy lab, because it's really important that I do it there. Till then, you must know a few things: the diaphysis and epiphysis thing. The elongated shaft that we have here in a long bone is known as the diaphysis, and the ends we have are the epiphysis. Okay, the elongated shaft is known as the diaphysis, and the two separate ends we have are known as uh, epiphysis. Okay, I don't think that I'll be discussing this here. Well, this much is what you need to understand as bone. Any problem with the bone? किससे पूछूं? अर्पिता मजुमदार.
Yes, sir.
Any problem bone में?
No,
कुछ
sir.
समझ में? Okay. Every time start saying that any question, somebody leaves the meeting. Okay.
Okay, sir.
We have few moments, but I think I will stop here the class, and I will send you
Sir,
the. Yes.
can
Yeah,
I
yeah. बोलो.
ask a question? Sir, सर ऐसा कहा जाता है कि जैसे बोन्स
In
रिजिड होता
English,
है.
please. Bone. हाँ क्या होता है
मतलब
बताओ.
सर बोन्स रिजिड होता है तो सर अक्सर सर बोन्स टूट क्यों जाता है सर?
Exactly the same reason. वो rigid होता है इसी वजह से. वो rigid होता है, flexible नहीं होता है. समझ में आया?
ओके ठीक अंडरस्टैंड.
वो rigid होता है, flexible नहीं होता है, इसीलिए वो टूट जाते हैं. अगर वो flexible होते तो फिर नहीं टूटते. इसी वजह से ना हमें cartilages की जरूरत पड़ती है. When we talk about them, we need cartilages to protect, to help in shock absorption. एक लेकिन उनकी भी एक लिमिट होती है. Somebody jumping from above a table. तुम एक टेबल के ऊपर से जंप करते हो. Your body like you are jumping on, right? लेकिन आपकी बॉडी का वेट सपोज if you are 75 kgs का वेट and you are jumping from a table, you are about to have that amount of force because जब आप हाइट पे खड़े होते हो you have some potential energy. When you are jumping down, that is being converted to kinetic energy, and from there again आप लोग उसमें stationary हो जाते हो. So it requires some kind of shock absorption. आप लोग बाइक चलाते हो या कार, anything? A car, if it is not provided with shock absorption, it will be broken, exactly like the bones can break. Now, एक तो ये बात हो गई. Now, bone can heal itself. अपने आप को ना, it can heal. For example, if we see this, now, even though the bones break, it has the capability of healing itself. Okay. These are something that really need to be very delicately explained to you in the class, in the presence of students and teachers. जैसे मान लो ये बोन फ्रैक्चर हुआ. इन हियर इन्होंने अभी रिजिड होने के बावजूद भी फ्रैक्चर की बात की. Absolutely. But even though bone get fractured due to it being a rigid structure, it is not a dead tissue or not a non-living substance. It is a living tissue. Hence, it can grow, it can feel pain, and it can heal itself. Okay. So first thing you can see surrounding it and within the fracture area, a formation of hematoma happens. That leads to certain changes, the bony callus formation and then bony remodeling. After a point of time, you might not be able to, identify that यहाँ पे कुछ fracture हुआ था. Okay, so bones, even though are rigid, they are also living structure, living tissue. Any more questions for bones?
No, sir.
Okay, all right. So क्लास समझ में आई आज की?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Very
Yes,
good,
sir.
very good, very good. Asha, now I want to tell you, I want to talk to you about something really. Like, honestly, I want to talk about something that, say, we heard something unpleasing from you people, a few unpleasant actions from your end. Okay, so few unpleasing actions of you people. ऐसा क्यों हुआ? I don't know. I know that the people who are on YouTube cannot reply. But what is this? What happened? Everybody, ओए, क्या हुआ था अचानक से आप लोगों को? Why you stopped behaving the way a student behaves? उसकी जगह पे आप लोगों को क्या हुआ? अरे बताओ. चलो, everybody turn on your mic. Yeah. Yeah. When you start commencing your classes, when you are going to college, there are few things you should do. Okay. What are the few you should do? We know that you don't know so many things, right? अभी आज अगर हम लोग आपकी क्लास लेना स्टार्ट करें, literally, genuinely, why we are taking classes and you are you are present on the other side of the table. Vikas Chaudhary.
Yes, sir.
बताइए, हम लोग जो क्लासेस लेते हैं, why do we do that? Why do we take those classes? And you are among those who are listening to it.
Sir, hello.
Yeah, बोलो.
Hello.
Yeah, listening.
Sir, आपकी बात नहीं समझ में.
I am telling that when a student joins a college, okay, why he or she joins a college? So that he can learn something. Everybody agrees?
Yes, sir.
Yes, sir.
Yes, sir. Yes, sir.
Yes, sir.
Yes, sir. Yes, sir.
Who are going to learn? The students.
Yes, sir.
From whom they are going to learn? The teachers.
Teacher.
Right? Everybody agrees to this?
Yes, sir.
Yes,
Yes,
sir.
yes, sir.
Yes, sir.
Now tell me, can you learn something from a teacher if you don't show respect?
No, sir.
No, sir.
No, sir.
No, sir. No, sir.
What was the point of all those nuisance you all created? I don't know. What was the point of all those? I don't know what kind of actions you were thinking. What were you thinking? If you cannot show respect, fine. Okay, don't show respect, but don't disrespect. At least that's the bare minimum you can do here. That's the bare minimum you can do. This behavior we heard about from the first year 2021 is so not done. you're talking like you're making jokes of people who are like अगर एज की बात करें ना तो आप लोग उनके just a sec. Talk. Yeah. You don't even have the like आप लोग का बर्थ नहीं हुआ था ना तब से आपके जैसे कितने सारे स्टूडेंट्स आके और चले गए ऐसे टीचर्स का आप मजाक उड़ा रहे हो ऐसे टीचर्स का आप मजाक उड़ा रहे हो ना जिनके पास आपके कुछ टीचर्स हैं जो सीखने चले जाते हैं you're making fun of those people who are the like basic builders of the future of certain of your seniors आपके कुछ सीनियर्स एम्स में हैं आपके कुछ सीनियर्स आउटसाइड इंडिया हैं आपके कुछ सीनियर्स अच्छे अच्छे हॉस्पिटल्स में हैं कितनी सारी जगहों पे एंड नॉट बिकॉज ऑफ यू आप लोगों को लगता है क्या कि आपने कुछ किया उसमें did you do something in their like in helping them in forming their future no
No, sir.
No, sir.
it's those people जिनका आप लोगों ने मजाक उड़ाया जिनके ऊपर आप लोग मीम्स शेयर कर रहे हो they are the guys not you they are generating their salaries and securing the family and not because of you because of those people जिनका आप लोग मजाक उड़ा रहे हो so basically the name is not clear but honestly आप लोगों को ना शर्म आनी चाहिए ऐसे एक्शंस करते हुए okay I think I'll end the class with this note
Oh, yeah, sorry,
thank you
sir.
so much
sir.
yeah even I am sorry that we had to face all these things from you I was not feeling to take your classes but again it was those people only जिनके आपने jokes बनाए थे ना it's because of them only I am taking your classes and honestly it's just because of them and not because of you chalo thank you
सर सबने तो ऐसा कुछ
थैंक यू सर
स्टूडेंट्स ने किया
Thank you, sir.
Thank you, sir.
Thank you, sir.
थैंक यू सर
Thank you, sir.
Thank you, sir.
Thank you, sir.